Countries around the world continue to approve booster shots for ever larger segments of their populations. In the U.S., they're now approved for 16 and 17-year-olds. A real-world study in Israel, meanwhile, indicates that boosters reduce the risk of death for people 50 and older by 90%. Kim Do-yeon has more.
U.S. health authorities on Thursday approved the use of Pfizer's COVID-19 vaccine as a booster shot for 16 to 17-year-olds.
16 and 17-year-olds are eligible for boosters. So my message is really very straightforward and simple. If you got vaccinated 6 months ago, and I say to all of you in the press as well, not a joke, I say to all of you, if you got vaccinated 6 months ago, get your booster right away.
Centers for Disease Control and Prevention Director Rochelle Walensky encouraged the use of the shots, saying that initial data shows boosters strengthen protection against the Omicron variant. According to data from Pfizer, a third dose increased antibodies 25-fold compared with 2 doses against the Omicron variant. The CDC director's recommendation was the last step before many states and vaccination sites began making boosters available to the older teenagers. The government actions come as many older teenagers have passed the 6-month mark since they got their first 2 doses, when studies indicate vaccines lose some protection.
We've seen that people who've been vaccinated several months ago, more than 6 months ago, have that waning immunity, and we're facing a variant that has the potential to require more immunity to be protected.
This comes as a study from Israel found that a third dose of the Pfizer coronavirus vaccine reduces the risk of COVID-19 related death by 90% for people aged 50 and older. According to the 54-day study posted in the New England Journal of Medicine, a group of 760,000 participants who had the booster shot saw 65 deaths, while a group of 85,000 people who hadn't had a booster shot saw 137 deaths. Israel approved the use of booster shots in July, making large-scale real-world studies possible. But the researchers said longer-term follow-up studies are still warranted to assess boosters' effectiveness. Kim Do-yeon, Arirang News.